Hi, Jenny from America, back again. I just wanted to give, this is part 3 on Baby D. Wanted to give you some information here that from that recently leaked document that I found, and also from something from Thirlwall too on Baby D. Just wanted some more information I forgot to give you when I gave you part D, is that apparently when this is a term baby, meaning it was 37 weeker. And when they intubated that baby, put that tube down its throat, that training took them 3 times to intubate. This baby should have been an easy intubation for those trainees. And certainly, again, where's the consultants? And then, again, I mentioned that the baby went into that horrific thing called DIC, disseminated intravascular coagulation. Basically, when you go into that, you just don't go into that. It is always something due to something horrific going on in your body. It could be sepsis, it could be trauma. There's even certain pregnancy complications it can happen to, and basically, and cancer too. And basically, oh my God, to treat it is just horrendous. I've had adults in it, and it is the most horrific death I've ever seen in my life. I mean, it's just so bad. And basically, you're just pouring it blood products. There's some question whether or not to give them anticoagulants and stop the clotting, and then you're not only doing these life-saving measures to treat them, but you have to treat what the cause is. And if it's a bad thing, if it's a bad cause and sepsis, you got to treat that sepsis. So again, you just don't, it's not like something you go into, only go into it as a last resort, or your body is as last resort. Your body's inflammatory response just goes haywire, and it's a response to something traumatic. Now, what I wanted to give you here is what I found on that, and read to you from that leaked document down here on Baby D. And basically, this is the consultants sent over, I guess, a packet or information over initially to Operation Hummingbird, and this was part of the initial one. And again, oh, damn, as a chart auditor, I can read right in between the lines here. So it basically says 37-week gestation baby. 40 weeks is full term, but it's still, that just tells you it's a term baby. Admitted to the neonatal intensive care unit at 3 hours of age with congenital pneumonia, meaning it was born with pneumonia. Subsequently, she improved clinically. And I guess I'm calling bullshit on that too. That was that last gasp resort on day 3 of life. Now, that is, I can tell you right now, that is a big thing here. And that's to make it look like the baby was getting better, improving on day 3. Yes, the baby lived 36 hours. But they were able to, let's say it was born again, in the evening on the 21st, had an only full day was the 21st, and it died early morning on the 22nd. 4 o'clock, something to that effect. So see how Brewery, I'm going to call him what he is. He's a bastard. Able to make it, again, extend 3 days, because 3 days is a pretty, you got 3 days on a neonate. That tells you something on a term baby. They're usually pretty good. She became mottled and developed dark brown, black tracking lesions across her trunk. Yeah, that was bleeding under the skin with the DIC and the 2 bruises. Same thing. Thought at time to represent infection, yes. But as the baby improved, the areas of discolorization completely disappeared. Well, yeah, the body, what is it doing? It's bleeding, it's clotting. It's bleeding, it's clotting. It's going through this cyclic thing. So again, things will appear and go away. Areas of discolored then reappeared prior to sudden deterioration. But yeah, no response to resuscitation efforts, awaiting an inquest. So see, they're able to delay this inquest. Isn't that sad? So primary cause of death is pneumonia with acute lung injury. However, the baby was on CPAP and had no oxygen requirement immediately prior to deterioration. Like I said in my previous video, it was on life support on a ventilator with a tube down its throat. It was weaned off of that incorrectly, not following any set protocol or anything that would anyone who's ever been to medical school would have ever been taught, totally incorrectly. And then it was placed on it was the lab values were deteriorating, and we placed it on CPAP, and then they take it off CPAP in an attempt to wean it quickly. Well, no. And again, so baby was on CPAP and had no oxygen required immediately, only because they took the damn oxygen away. It needed it. Therefore, clinically, this makes acute lung injury as the cause of deterioration and subsequent death very unlikely. On post-mortem, there was a hyaline membrane that is seen in adults with severe lung injury. So it definitely would have been seen in a neonate too. So the transient rash is also unexpected. Consensus of the Countess of Chester pediatricians and external Liverpool neonatologist. Again, was this Nim Sebahara, who was a friend? I think he was a pro consultant to, the Countess of Chester consulted one of their buddies. Again, let me know if that is not the case. And that the cause of sudden deterioration and cause of death is still unexplained. Oh my God, how horrible. What a bunch of lying you-know-whats. Now here's Dewey when, after he's seen that first batch too, he gets back to the detectives and he makes, there's the notes from the detective, and actually, they're just scribbling things down, admiring his genius. Again, so he's saying correctly, baby had poor care on the 21st and 22nd, but 21st June gas was normal. Well, yeah, again, that could have been during the last rally. And on the 22nd at 1 a.m., the model lesions across abdomen, no oxygen needed. No oxygen was needed. They just didn't give it to the baby. Bruising in an abdomen, it was on antibiotics. It was on the incorrect antibiotics. It was on mild, to some degree, antibiotics that would have covered normal flora. It needed to be on heavy-duty crap. So at 2:35, it improved. Yeah, that probably was that last hurrah that body's trying to rally itself. But anyone with any experience knows that to never take a rally with a grain of salt. Yes, it may be a rally. Yes, it may be a miracle, but we've been burnt so many times that you always keep an eye and always assume that this could be a false rally. So discolorization disappeared, and it disappeared, and then it looks like another discolorization. Yeah, the blood is clotting, bleeding, stopping bleeding, come and go. Again, you'd see this in sepsis. You see this in DIC. You'd see this when your cardiovascular system is collapsing. You go blotchiness here or there, comes all the time, and then crash and died of infection. Postmortem intracranial air present. Postmortem says postmortem could have caused it. Dr. Irvin thinks born with infection, yes, but could it be air in which transported to the brain? I don't know what he means. Is he doubting the postmortem and saying that Lucy Letby did a air embolism and somehow that air embolism went to the brain? God only knows what's going through that brain. Shouldn't die from pneumonia. Oh my God. Oh my God. Pneumonia has always historically, we've known about pneumonia for thousands of years. It has always been a main cause of death. Oh, Dewey, you are just an idiot. I don't know, idiot, evil, what do you call him? And the fact that, and just stupid, these detectives, did they ever bother to even ask a neonatal nurse? No, they didn't. All they had was an adult nurse with them. And we don't know what that adult nurse saw. But again, I, as an adult nurse, with no neonatal experience, only neonatal chart experience, if I would have been seeing this, I would have been laughing at how silly it was. So anyhow, again, Datix me if you have any concerns or questions, any thoughts. Again, oh, this is just it's sad, the saddest thing. And again, again back in 1989, I gave birth to a septic child. I myself was septic too. I had 102 temperature. Again, I was monitored so well, and the minute my white blood cell count started inching up, that's when they started me on antibiotics prior to the birth, and then immediately my baby got antibiotics immediately too, and we both were treated within that what we call that golden hour in sepsis. It's a known thing. It was known back then. You need to treat as soon as there is any sign of infection. Within that hour, you treat immediately. And the only reason they kind of let me go a little bit longer with my premature rupture of membranes, they needed to extend things. They needed to, my baby was premature. They wanted to keep her in and let her mature as long as she could. And again, they were taking blood from me every 6 hours just to see how quick, if my white blood cell count would go up. And immediately once it did, that's when they started the stuff. And again, that's again, not too long after that is when my temperature shot up. They delivered this baby quickly. They had a registrar at the birth, a neonatal registrar who knew what he was doing, unlike these trainees, and got that baby, and again, put her on life support immediately, got her that antibiotic immediately, and then got her transferred over to the high level neonatal intensive care unit. And again, she was born 2 in the afternoon, and then and on life support and premature, and by 7 o'clock that morning, she was off oxygen, off life support, and able to tolerate and strong enough to suck on a bottle and take an ounce or two of formula. Only thing she needed was a little bit of heating with her incubator because she was small. So she needed a little bit of a heat to keep her warm, but that was it. I was able to, in fact, by 10 o'clock in the morning, that morning, that baby she wasn't even 18 hours old. I was able to nurse her. And breastfeeding is harder on a child than bottle feeding because it takes more energy and its sucking is hard. And again, the neonatologists were just so thrilled. They were even thinking about sending her home in a few days on oral antibiotics. But again, they were so happy with the rally and thinking it was such a good thing. But you know what they did? And about 15, 20 minutes later, they changed their mind saying, no, even though it's a wonderful rally, again, let's not tempt fate. Let's keep her in for the 10, 11 days of antibiotics. And then they kept her another additional day after the antibiotics were finished just to make sure that she was well and fine and safe to go home. So they kept her in as a precaution. There was no precautions given to this baby. There was no thought to how to remove it correctly from ventilation. No thought in how to give it correct antibiotics. It was clear the sign that baby should have responded immediately to the antibiotics, especially since it was what we would have called a term baby. And the fact that it didn't rally on the antibiotics tells you something. They claimed it rallied, but that was a false rally. And again, a trainee, I still have to question the training of these trainees, even before they came to the Countess of Chester. How well were they trained? Yes, the consultant needed to be there. And again, the consultant needed to guide him so far as weaning this baby off of ventilation. But again, my baby had maybe 5-10 minutes of time during that whole period where she was in like 11, 12 days. Barely ever saw a consultant. Maybe saw the consultant 5 minutes after, that next day, and then maybe 5 minutes here or there. Didn't need to. She was being cared for so beautifully by the same level trainees at the Countess of Chester. It wasn't needed. It wasn't needed. And again, it was probably not needed because one of the reasons was first of all that The consultant, the head of the neonatal department, had massively high standards on himself, and he demanded as high of standards all for the trainees. And he knew he could trust them and stuff. And again, so I'm so happy I had a great outcome. But again, this was the one that kind of the call to action. Once I read Baby D's mom's experience, that's when I started commenting on YouTube, and that was back again in December of 2024, and that's when it really I really started to get involved in the YouTube movement and to help, and started doing comments on it, because it just I just so sad that Baby D's mom didn't have the same experience I did. Again, let me know if I have said anything wrong, or if you need to self-date. I want to be self-dated. I like all your comments. Take care. Bye-bye.